Okay, so we are going to start Be'ez Hashem's second session. Last session we spoke about the concept of Chayei Shah, someone jeopardizing his Chayei Shah for the benefit of Chayei Olam, meaning that he's risking his life, and if he does some type of refuah operation, something like that, that would lead him to have a better quality of life after that. So in a case, we saw different sources that in the case that it's the way the Shchus Yaakov said that he consulted other doctors and he really looked into it seriously, v'chulei, that is enough of a reason that he's allowed to do it. And the first source that we learned it is the Gemara in Avodah Zarah Daf Chav Zayin, that we learn it from the Arba Mitzrayim of Gehazi and his children. I just want to clarify before we go on to the topic that we're going to talk about today, and that is Chayei Olam Chayei Shah by two people, okay, not by one person. I just want to clarify another machshava that I had that maybe I did not specify enough last year, and we explained basically the question that was asked last year, and is a question that everybody asks when they learn that sugya. If you say the Chayei Shah is Chayim, if so, how could a doctor risk Chayei Shah? L'chura, the Yisur of Lo Yisir Tzach is in any case, right? In any case that you have, even if someone has is a goysis and he has 1 hour to live, 1 minute to live, and someone goes and takes away that life from him, that is considered to be what? Taking away Chayei Shah, that is the Yisur of Lo Yisir Tzach. And we're not going now into there is a punishment or there isn't a punishment on it, but Lemaisa is, this is considered to be a Yisur of Retzicha, and that for sure is also. So how come one could go and do a risky treatment when we know that it may lead to Lo Yisir Tzach? So we answered what we answered. I want to say the same answer, but a little bit different. Be'etzem, we know the Gemara in Bava Kama, the Gemara says that we learn from the pasuk V'rapo Yerape Mikan Shenitno Rishus LaRoife Therapois. That is right, one of the famous Gemara that everyone knows, and in your field, if you know it by now, so you better know it. Okay, what is the pshat of V'rapo Yerape? The Shulchan Aruch paskins that leHalacha in Yoredei Siman Shin Lamed Vav. And the Shulchan Aruch says, "Uvezeh bichlal pikuach nefesh." That's what okay. So everybody asks, so what is the rishus? What's this lashon? The word the rishus. What do you mean by the word rishus? So the Taz said that truth is that the real healing is someone is ill, so you should ask rachamim for HaKadosh Baruch Hu. But if he wasn't zoichet that HaKadosh Baruch Hu healed him, then he should go to the doctor. So Mimele, that is the pshat of the Taz, that is refuah, meaning refuah is the second thing that you have to do. The Shach there says no. The Shach says no. V'rape, what does that mean? Rishus is something else. Rishus means shelo yoimar. It's referring to the doctor, that the doctor should not say mali. Why do I have to go and help people and put in 15 years of my life just in studying and, perfecting myself? And then in the end, I may chas v'shalom do something and risk somebody's life. So why would I do that? No, the Torah says, Mikan shenitno rishus laroife le'rape. That's the pshat that the Shach explained. What does that mean? It means, what he means to say is, that once a person comes with a kavanah and the right set of mind that he wants to be matzel nefashos, and if he does like the Shchus Yaakov, and he consulted other doctors, and he did it seriously, meaning he did it in the right way, in such a case, the pshat is, in such a case, we say that what? He mikan shenitno reshus laroife lerapos. That means he is doing a peulas hatzola. So what did we ask? We asked the question, what are you doing? Are you you are risking somebody's life for some type of procedure that may be a very, dangerous procedure? How are you doing something like that? What is aren't you afraid of leisirtzach? The answer is every morning that I get up and I go to work, or 36 hours straight that I work, right during my job, when I go, every second I'm afraid of leisirtzach, and that is for sure. But the answer is I know, and that is that I'm coming to do good. I'm not coming to do any harm to anyone, and I'm trying to do the best I can, and therefore it's not even a shaila. That's what I'm saying. It's not even a shaila b'chlal that we have a chashash of chashash isur. And I want to explain what I'm saying. It's not even a shaila. By the way, I'm just b'derech hagav. I'm trying to put in a lot of other musagim that you should know since it's condensed. So I'm putting in a lot of other musagim that you should know and you should have, because we won't be able to cover everything. I'll give you another example. What do I mean by saying it's not even a shaila? There is a halacha that is a machlekes between the Ramah and the Mechaber regarding a child treating a parent. Okay, where there is a chash of itzas dam. Okay, where there's a chash of taking out blood, because taking out blood may be an iser of choyvel be'aviv. Choyvel, someone that, right, takes out a little bit of blood more than he's supposed to take out is a chabala. So if you do it to a patient, nishgeferlach, nothing happened. But if you do it to a parent, the way the Ramah says, the Shulchan Aruch says, it's chash chenek, because someone that is make avi ve'imoy, the punishment in Beis Din is chash chenek. So I'm saying it's a very, very chomer thing. There, according to the Shulchan Aruch, you're not allowed to do it in any condition. According to the Ramah, you're allowed to do it if there's no one other that could do it, without going into details. There you have a shaila. That's what I'm trying to say. There you have a real shaila. Here, as I'm saying, it's not a shaila. Why is it not a shaila? Because we explained, and we said, you consulted, you did what you have to do, that's it. You don't have to now go into and be very nervous about it. You have to be calm and normal about it. Okay, so now we are going to continue, and we're going to talk about the topic that we're starting today, that we're going to cover this topic, and that is the topic of Chaye Shah, of two people, Chaye Shah, of one person to another. I'll give you an example, a simple example, and that is what happens. We're going to see what happens if you have two patients in front of you, and you want to know who to treat first, someone that has a Chaye Shah and someone that has a chance of Chaye Olam. That's one question that we're going to deal with, meaning who to prioritize. A second question that we're going to deal is, let's say the Chaye Shah was first to come, and he is already on the respirator. He's already, in the intensive care unit, and you only have 5 beds or 8 beds there. And now you have a pressure, and you know that this person has a Chaye Shah, and you want to give this bed to a different patient that has a better lifespan, a better chance of living, a Chaye Olam. What do we say about that? So that is the questions that we are going to deal, different than the shir the past year. The past year we dealt in the same person. Here it's 2 people. Okay, so we want to see 2 sources about it. This Gemara in Sanhedrin. Okay, this is a Gemara in Sanhedrin, Daf Ayin Daled, the famous Gemara, where the Gemara talks about how do you know that you are allowed to be Mechal Shabbos in order to save somebody else, right? How do you know Pikuach Nefesh Doiche Kol HaTorah Kula? Gemara here, we're not going to go through this Gemara because we don't have the time, but this is a Gemara that I recommend everyone to learn this Gemara. But the Gemara says there in the end of here, where you see here this arrow, the Gemara says, "Roitzeach gufei minolon." The Gemara says, and how do you know that one could not be over on gimel averes chamuris in order to save somebody else, right? Meaning, we have a question. The question is that we know that pikuach nefesh doichet kol haTorah kula chutz from gimel averes chamuris. So one cannot kill somebody else in order to save himself. So the Gemara says, "Roitzeach gufei minolon." How do you know a retzicha? The Gemara says, "Svara hu." I don't need a source for that. That is a svara. What's the svara? So the Gemara says, "Daud also lekamei de Rabba." Someone came to Rabba and asked him, "Rebbe, I have a shaila. Omar li Mori Duroi." The poets told me Mori Duroi is the head of the town. Meaning, we're talking about someone that is a very powerful person. Told me, "Zil katle leplani." Go and murder this person, Pliny. Biloy, and if not, Katlina loch, if you don't kill him, meaning bekum vasei, do an action and kill him, I am going to kill you. Omar lei. So Rabbi told this person, likteluch, they should kill you. Veloy tikto, you should kill and be killed and not kill. Why? What's the svara? Mi yemar dedama didoch sumek tfei. Who says that your blood is redder than somebody else? Maybe his blood is more red than yours. What does that mean? Red regarding what? Says Rashi. My chozis, right? And that is a famous yeshivas. It's called my chozis. The svara of my chozis. I'm sure you'll hear it from me a lot of times. Mi yoidea, says Rashi, she'adam kochavi b'noeh liyotzrecha. So first of all, Rashi explains to us, we're talking regarding you and HaKadosh Baruch Hu. And we say, who knows that regarding HaKadosh Baruch Hu, your blood is what? Is more red than you tell me, Dam Chavercha, your blood is more precious to HaKadosh Baruch Hu from your blood. Hilkach. Meaning the Gemara said before that how do you know that in all Averos we say that the Gemara says that the Torah was given you to live and not to die. The mitzvahs of the Torah were given for us to live, but if you have to keep a mitzvah and by keeping the mitzvah you'll lose your life, we don't say you don't have to keep it. So therefore, the Gemara says, but if that is between two people, that's only by yourself. But if it's between you and somebody else, then we don't say and go do an action of murdering somebody. That we won't allow you to do. So therefore, why? Because he says the whole reason of says Rashi every Jew is precious to HaKadosh Baruch Hu. So how do you know who is more precious to HaKadosh Baruch Hu? And here, when there is an ibud nefesh, meaning you're doing an action of murdering somebody, then you cannot do something regarding that because the Melech, meaning Melech Malchei Amlochim, told us you can't do that. So what is this svara here? First of all, when we deal with two people, we have to know one person is here, his nefesh is chaviv. You are here and your nefesh is chaviv, but you don't know, and we have no way to know whose nefesh is more chaviv in front of HaKadosh Baruch Hu. That is this Gemara. So first of all, that's the way we are starting. Now, this is a very famous Gemara in Baba Metzia, the end of Perak Ezu Neshech, where the Gemara here talks about Malve Beribis. The Gemara says that there is an Iser to lend money to somebody else with interest. And the Gemara says, what is it? The Gemara says, Al tikach mitoy neshech v'tarbis v'yoreisom elokecha. Then the Gemara said that the Gemara compares it to shoifchei domim. And the Gemara says that the way when somebody spills somebody's blood is somebody's blood, you can't return it. Says the Gemara, what's the reason? Omar Rav Nachman, this is what's important for us. Omar Rav Nachman, Bar Yitzchok, my time of the Rav Lezer, the Omar Ko, because the pasuk says, "B'chai ochicha imo," your brother should live with you. Ahadar le'keich the nechi. You have to make sure that that he is able to live. Says the Gemara of Rabbi Yochanan, what does he learn from V'chai Achicha Ima? And that, I'm not going to go, I didn't read the Gemara before because this is what we need to know for now. V'chai Achicha Ima, my Ovidlei says the Gemara, Me'ibar Lechid Tanya, famous Gemara, Shnaim Shem Malchim Aderech, Ubiad Echad Mehem Kiton Shemayim, Shoisim Shnei Mesim, V'shoisei Echad Mehem, Magia Leishu. Story, two people are walking in the desert or in the way. One is holding a bottle of water. If both of them are drinking, both of them are going to die. It's not enough for both of them to live. But if one of them is going to drink, he will be able to get to a place where there is water, but the other one is going to perish. Says the Gemara, Darash ben Peter mutar shish to shneim v'yomusu v'alir echad mehem b'misasa shel chaveiroi. Ben Peter gives you a very, very interesting psak. Says Ben Peter, both of them should drink. If you think about it, it doesn't make sense. Both of them should drink, so both will die. Yes, that's what he says. V'alir echad mehem b'misasa shel chaveiroi. One should not see in the death of the other one. So this sounds like a very passionate svara, but if you think about it, it's a difficult svara to swallow. Rabbi Kiva comes and at Shabbat, Rabbi Kiva velimed, Rabbi Kiva taught you, the pasuk says, V'chai ochicha imoch. What does that mean? Your brother should live with you. With you means first you have to live, like they say on the plane, right? First you put on the mask and then put it to whoever is sitting near you. What does that mean? Says Rashi, there isn't enough water for both. Okay, so now, this is the famous Gemara. So, what is the pshat? Basically, what is the pshat that Rabbi Kiva is saying? Your life is before your friend's life. So now, I want to see with you also a famous Reb Moshe that speaks about this, speaks about the famous question. And Reb Moshe is going to deal with the question here that we talked about. Look at this. Shnei cholim. שאחד צריך לריפוי בוודאי, והוא רק לחיישו, והשני סופק אם צריך לריפוי, אבל יכולים לרפותו איזה מהם קודם. אוקיי, so let's see. ובדבר שני חולים, אחד שלפי אומדנה שהרופאים הוא רק ריפוי לחיישו, להאריך ימיו במה שאפשר להם, ולפעמים הוא רק לסלק האיסורים, אבל צריך לטיפול נמרץ. Rabbi Yossi says you have here a person that has חיישו, but he needs the intensive care unit, והשני לפי אומדנה שלהם יכולים לרפותו, אבל אין ידוע להם אם יצטרך לטיפול נמרץ כזה שעושים בבית חולים ביחידה לטיפול נמרץ. Meaning we don't know if he needs the emergency room or he doesn't need it. ויש שם רק מיטה אחת ביחידה. We have only one bed available. מי קודם להכניס לשם לטיפול נמרץ בתחילה כשבואו בבסחה. So Ramosha is starting like this. The first scenario is they came together. Okay? In a different case, you should know, but in Eretz Yisrael, we learned it a lot in times of trauma, in times of terror attacks, and you don't know who to start with. And you have a first assessment. Okay, you have a first assessment. This one looks like a chayesha. This one looks like we could help him better. What should we do? So Rav Moshe starts here with, remember, the case here is that bo bevasachas. No one has here that he came first. Or in a case where one is already inside, but they didn't start to treat him. Rav Moshe is hinting that if we started to treat him, so then obviously the one you started to treat, you don't stop. היינו קודם שהכניסו אחד מהם, צריך להכניס בתחילה את מי שלדעת הרופאים הנמצאים שם יכולים לרפאותו, אם גם לחולה זה צריך להתחיל תכף, אם יש צורך אף מסופק. So says Rav Moshe that if both of them came bevasachas, so it makes sense that what? That they should choose the one that they have more of a chance to help. Right? So that is if they didn't start treating. But if they already put in the choyle, you don't take him out of the unit if you already started to treat him. So he says, if he's already there, you don't touch him. Says Rav Moshe, I don't care if it was done by mistake, if it was done by meaning not by the doctor that is in charge. Somebody already did it. Once he's there, you don't have the right to take him away. What's the reason? Says Rav Moshe. סתם אינשה, עדיף הם מאלו שעומדים למות מצד חודש שלהם, שלא ידוע לרופאים רפואה למחלתו, אבל זהו לעלמד ולכל לעצמו נקח חיוב להציל נפש אחרים בנפש. He says, regarding the doctor, you're right. The doctor always maybe has the right to think who has more of a chance that I can help him. So from my end as a doctor, I could maybe stop treating him and go treat somebody else. Says Rav Moshe, that's for other people. But the sick person himself, says Rav Moshe, but if we deal with the choyle himself that is laying on that bed that we need now, he doesn't have a chiyuv to give up his life in order to save somebody else. You as a doctor, okay, you want to think who you have more of, what could I give more, so I could give more to the one that has more of a chance of chayei olam. Maybe that's a svara, but the choyle is already on the bed. So now by you going to the choyle and taking him out of there, you're basically what? Telling him, give up your life to save somebody else. So the choyle is yelling to you and say, no, don't do that to me. I have the right to live, even though my life is not such a great, it's only chayei shah. Says Rav Moshe here, this a very interesting svara. Says Rav Moshe, listen to this. Since they put him in the unit lerefuato, this is the punchline of all of Rav Moshe, these three words. What is this word zocha? Is this choshen mishpat? Is this monetary law? He owns this bed. As far as we know, there's a hospital, there's a system here. Okay? We'll see a second if we're talking about a private hospital, whatever. But Rav Moshe says here a very interesting svara. In order to understand his first svara, meaning once the patient is holding the bed, the patient doesn't have to give up the bed. Meaning if it's a private. Even if he doesn't pay, okay, bechinam or means that it's public. And right in a lot of places, if someone doesn't have how to pay, so they also treat him. So maybe this is also here we'll say, שם להיות שם, הזמן שצריך להיות שם, והשעבודים שיש לו על הבית חולים, והרופאים, ושם לרפואתו, ואינו מחויב, ואולי גם אסור שייתן את זכותו. Says Rav Moshe, first of all, he's not obligated to give up. And maybe it's even usher for him to do that. שעל ידי זה יחיה חיי שו, שהוא הזמן הקצר שאפשר לו לחיות לחולה אחר, אף שראוי לחיות שיתרפא כל ימיו הקבועים לו. Now this is very interesting. Ramosha is mechadash as a svara, without, in the meantime, without giving us any sources to this svara, but Ramosha says basically the chole is not obligated to give up his life for somebody else. Wow. But what does Ramosha say? Ramosha says something very interesting, and Ramosha says that maybe it's even usher for him to do that. Now, in the Gemara that we saw a few minutes ago regarding Shtein Shom Malchim Bader, Rabbi Akiva says Chayecha Koidmin. According to Rabbi Akiva, if I say take the bottle and you take it, it's mutter to do that or it's usher to do that? Is Chayecha Koidmin a recommendation? Is that a recommendation, or Chayecha Koidmin means no, you have to live, right? So one is to give up your life. So I think in the Gemara there probably would be mutter to do that. Why? Because I believe that the Gemara there is you're not giving your life because you're giving the bottle of water. Understand? You're giving the bottle of water. The bottle of water, maybe we'll find a well of water soon. It's not like, a suicide, a definite suicide. But here, when you're giving a treatment of a chayei shol, l'chura, it's that. I'm saying as a svara, think about it. That's not, our main thing. Then Ramosha says, ומסתבר שאף אם השני שאפשר לרפאותו הוא נע מעתה מסוכן גדול, שצריך להכניסו מתחילה לחדר היחידה, גם אין להוציא את הראשון שנמצא שם, אף שחייב הוא רק חיישו לפי אומדנוסף, שהרי גם להציל ודאי אינו מחויב החולה בנפשוי ורק קודם, okay? Okay, now skip these lines and now go to here. ואף שהחולה יודע מצבו נמי יש לחוש שיתערב דעתו. Here Ramosha comes and says another interesting thing, and I picked from Ramosha things that I think you could benefit in your life. And think about where a Gadol B'Yisrael you see that is not a doctor is thinking here. Forget about the medicine part. If you go to a person that lives a chayei shah, remember, chayei shah doesn't mean necessarily a day or two, and even a day or two is also life. And you basically tell him, listen, I need the bed for somebody else. What are you doing? What are you doing? Forget about being a doctor. You're a mensch. You're a person. You're telling him, okay, you're hopeless. We don't care for you. He could die on the spot just from that. Now, you won't find that in literature, okay, any medical literature that says that. But that is a svar that Ramosha says. And that is a svar that I think that every person has to think about. Meaning, by words, and it's important to know the power of words and the way the doctor treats and talks to a patient, and the care that he gives the patient could change a person, and also could give a person a life of mamish, give him a feeling to live, and that's very, 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 very important to know. Okay, so these are svaras. As I recommend, always learn this Ramosha back and forth. This is important. Comes the Minchas Osher when he talks about this tshuva. And he talks about this question. So he says always the beds in the what's his name in the ER is very, very in the intensive care is limited. So he says. So always we have a problem. ולפי שיקול הדעת הרפואי יש צורך לאשפז אותם במחלקה. זו מוצאים חולים אחרים שהצורך שיישוב מחלקה זו אינו גדול כל כך. ונשאלתי, האם יש להוציא חולה סופני עם סרטן מפושט? If we could write a terminal ill patient that has cancer all over, that בדרך הטבע he has a very short lifespan, and should we take him out for a person that a young man that just went through a car accident? Because if they will be able to give him a good treatment, so he'll have a long life. האם חיי שעה של פלוני נדחים על ידי סיכויים של אלמוני? So he says, is this, right? Maybe the question is basically, will we push one person, right, ploni for almoni, nizkot l'chaim arukim kedarko shel olam. Now he goes through the sugya that we spoke about last year, so I'm not going to go through it, and we'll skip to here when he talks about this idea. Omnam kol zel gabe chayisho mul chaim arukim be'adam echad. That's what he spoke. What we skip now. When it's talking about two different people, סיכוייו של אלמוני לזכות לחיים ארוכים, וכבר כתב החזון איש שיודע בסימן ס"ט לחלק בין שני אנשים לאדם אחד. The Chazon Ish said there's a difference. What is the Chazon Ish talking about? The Chazon Ish is talking about the Gemara that we just spoke about. והנה במציאה, דף סמך בייס נחלקו במתר רבקים ושניים של מתחי בדרך, ויש ביניהם קיטון של מים לבין בתר ישתו שניהם עד שבו רבקי ולימד לחיי קודמים לחיי חברך. וכוסף החזון איש. Comes the Chazon Ish to try to explain the opinion of Ben Petorah. The ein lekapech velimnoach ha'isha michaver. Don't take away. You don't have the right to take away the ha'isha of a friend b'shvil atzolo didei. Meaning, the Chazon Ish is bothered by the question that we asked before. What is this Ben Petorah? It doesn't make sense. Two people should die? Doesn't make sense. Comes the Chazon Ish and says, no, Ben Petorah is saying that by you taking the water, okay, you are saving yourself and taking away the life of somebody else. Meaning one would say, what does that mean? But I am the one that bought the bottle of water. In this case, there's no such thing who owns the water. The ownership doesn't matter. You're both of you are in the middle of the desert. So the fact that you own it doesn't mean anything according to Ben Petorah. According to Ben Petorah, it doesn't mean anything. There is one bottle of water. You want to use it and drink it. Says Ben Petorah, by you drinking it, you're taking the oxygen, as if, I'm just right, I want to illustrate it. You're taking away the life from your friend. You don't have the right to do that because you want to save yourself. So that the even if both of you you'll drink, you'll have chaye shah, right? So both of you will have chaye shah because we know there isn't water. Says Ben Petorah, so both of you have chaye shah. You don't push chaye shah for chaye olam. But when it comes to two people, you don't do that. Okay. Anyhow, Rav Asher has an interesting look at this sugya. Rav Asher basically says that we should understand that it's very clear, this sugya, that if you don't drink, so if you drink and the other one doesn't drink, so he's going to die. Because he asked this shaila that we asked before. Everybody's asking this shaila. Doesn't make sense that to give to both of them to die. It doesn't make. Ela de sakanat tzibaon, meaning the thirst. Lav bilsa de psika here. It's not clearly that he's going to die. Ulefamim ishtehu v'chavero yichyeh v'hu yamut. Lefamim ishtu shtehem v'shtehem yichyu. He says it's not such a clear thing. Meaning the amount of liquid that we need in our body is not like fixed measures that we know. We don't know how much liquid the person has from before. These are things that are not clear. Ben Petorah says he has a different look at it. Both of them should drink. And Kivan says no. Okay, so that is interesting to know. But what does it no get us? So he brings Rav Moshe, okay, and he brings Rav Moshe here, and he brings and he says here he brings that's the Rav Moshe that we learn. Okay, ask the Minchas Asher, my Rabbi, what is this schia? I don't know how to deal with it. The chizocha min hefker. What is this schia that Ramosha says? What? He acquired it from hefker, meaning he's saying if you say that it's something that has to do with choshe mishpat, so where is it? Who does he acquire this bed from? Don't we have a system here of the hospital that is in charge of all the beds? And they could decide whatever they want, right? Hospital works like that all the time. They move patients from one unit to another. It happens often that I get calls from people that tell me, you are close to the heads of Shari Tzedek, and my grandfather is in intensive care, and they're taking him out, and please talk to them and that. And, today I already learned, but in the beginning I used to find out, and I used to try to ask, why are you doing it? And the doctors told me, because that is the good of the patient. That's true that intensive care, he has, a nurse, he has a nurse and a whole system on him, but there's other dangers to be there and then being in a regular unit. So don't always think that the fact that you have intensive care is the best thing. There's other cheshbonos also. So therefore, that's the first question that Rav Asher is asking on Rabbi Sprung. What is this schia? What's the pshat of Rabbi Sprung's schia? וראיתי בספר שושנת המקים of Rabbi Zilberstein, שדברי גספויש האמורים בבית חולים פרטי. So Zilberstein tried to answer that what Ramosha means to say, Zechia, he's talking about a private hospital. שכיוון שהחולה ובני משפחתו משלמים תמורת האשפוז והטיפול זכה במקומו. So he wants to say that Ramosha is referring to what, like a hotel. If I go to a hotel and I rent a room, so I own the room. I own the room that I have to do b'dikas chometz now for Pesach. I have some type of buy list that I have to do. So the same thing here you have to do. Is that true? Is that true also regarding you have to check chometz in the hospital? For sure not. That's not your responsibility to check chometz. So I would ask Rav Zilberstein, and he wants to say, and if it's not a private hospital, right? He says if it's memshatif, it's a government, so or whatever is it. So there, maybe Ramosha doesn't mean it. Why? Because there, everyone has the right to take you out. So basically, Rav Zilberstein wants to understand the word schia by Ramosha, literally schia of choshe mishpat. And that is right. I'm sure that you yourself were, because we saw Ramosha inside. The Ramosha himself made the definition between a private hospital and a general hospital, and he said before, not like that. ונראה, דאין כוונת ההיגרספוי של זכייה ממונית, אלא לסברה מסוימת בדיני קדימה. Ramosha did not mean to say that this is schia as someone owns it. Ramosha meant to say that this is a question of prioritizing. אם כבר קנה מקומו במחלקה אין להוציאו משם, דאין דויכי נפש מפני נפש. There is a halacha. You can't be doiche nefesh mipnei nefesh. Voitzorато min hamachlaka doma b'midah mesuyמת leibud nefesh. Meaning, if you take him out, so you are pushing somebody else. V'shayni mimatzav shebo shnei achonim adayin mechakim b'chutz. What did Ramosha say? If I have two patients that are waiting outside and I have to prioritize, that is something else. Then you are allowed to prioritize the one that you have more. You think there is more of a chance. But once there is a nefesh here that you started, then you can't stop. And therefore, ועלינו להחליט מי מהם מקבל מקום מחלקה, כן נראה בכוונתו של הגאון. אומנם לעניות דעתי נראית פי, Rav Asher comes with an unbelievable yesod here. שיש אכן להוציא את החולה הזה מן המחלקה ולפנות מקום לחולה שאפשר להצילו. Says Rav Asher. Not the way we had simple understanding in Ramosha. If there is a case here that we want to take him out and put him in a different unit, you could do that. Why? Because even when you do that, you're not trying to kill the patient. Rabbi say, don't understand that we're trying to kill the patient. What we're trying to do is, so he comes to explain two reasons. נראה, דכיוון שדבר זה מקובל, שמעבירים חולים ממחלקה למחלה בבית חולים לפי שיקול דעתם של הצוות הרפואי ואין שום זכות או אפשרות ממשית לחולה להתנגד להעברתו, הרי שאין כל מקום לחדש שכבר קנה או זכה במקומו, וגם במחלקת טיפול נמרץ מוציאים חולים כאשר יש הטבה במצבם, או כשיש מקרים דחופים. ומשום כך נראה, he's asking on Rav Moshe, every hospital was built in a way that the staff has the right to decide where to put the patient. So therefore you can't say that one has ownership. Doesn't make sense. משום כך נראה, די נפקא מינו בעובדה שחולה זה כבר נמצא בתוך המחלקה וחברו עדיין בחוץ. Therefore says Rav Asher, he doesn't feel that there is some any svara to say that the fact that you are now, you the patient of the Chayei Shah has a bed has a difference between you and the one that is outside. The location doesn't matter. Why? Because the one that makes a decision is the staff. Okay, the staff makes the decision. So it doesn't mean he's outside, he's inside. The location is not part of it. ואף לפי המובהר שאין כאן גדר שחייה עצמו מכל מקום, כיוון שאין כל קביעות במקום אשפוזו שחולה בבית חולים, ומעשים שבכל יום שמעביר חולים מחלקה, אין בזה כל משמעות. So first Svari says the fact that this patient is in the intensive care doesn't mean anything. More than that, he says. נראה שאין להגדיר הוצאת חולה ממחלקת טיפול נמרץ כאיבוד נפש. Said before, right? Maybe Rav Asher means to say ein doichin nefesh mipnei nefesh. You want to say that is not considered to be a ibud nefesh. The ikar hatoelet machlaka zu hi benitul. What's the specialty of intensive care? Is nitul. Nitul means that the care, the extra care that we give him. Hainu hashgacha tzmuda veretzifa של מצב חולה, monitoring him all the time. אבל אין הבדל משמעותי בין עצם הטיפול הרפואי הניתן. It's not a real difference in the care that he gets. And therefore, if I take out someone from the intensive care, it doesn't mean that I am doiche the nefesh b'pnei nefesh. That's what he's trying to say. Okay? So therefore, if that's the svara, he wants to say, אמנם כאשר מוציאים את החולה הסופני ממחלקת טיפול נמרץ, יש להסב דייתו ולא אמר לו סיבות שונות. He did realize what Rav Moshe said there in the end, and he says, but you do have to explain to him that it's not because of somebody else. Try to give him some type of explanation why you're doing that, and not because somebody has more of a chance of living. So we saw here another interesting yesod from Rav Asher, different than Rav Moshe. Now, we're going to end this year with a Chazon Ish that talks about this Gemara that we just saw. The Gemara here, this is the Chazon Ish that Rav Moshe mentioned before. Says the Chazon Ish on the Gemara of Shnaim Shom Malchim Bader. Says the Chazon Ish here, look at this. Rav Akiva Sovar, Ben Peter, Rav Moshe already explained. The Mishum Chayecho Koibim Niftar Me'atzalas Chayei Sho Shel Chavero. Venire. De'en Chavero Rashai Ligzol Mimenu Meimav. Listen to this. His friend is not allowed to steal his water. The Chazon Ish is asking a question. Okay, no problem. Comes Rabbi Akiva and says what? Chayecho Koibim, keep the water for yourself to drink. Can now the friend come and steal it from him? The Chor, you're allowed to steal, right? In certain cases, you're allowed to steal if you know you could give back, right? If you know you could give back. So Matzil Atzmim Momin Chavero, it's a whole sugya, but with David HaMelech, and in certain cases, you're allowed to ask the Chazon Ish after Ben Petor and Rabbi Akiva, am I allowed to go and steal it from him? Says the Chazon Ish, V'nira de'ein Chavero Rashai Ligzol Mimenu Meimav. De'af agav de'adam Rashai Latzil Atzmo. במומנט של חברו, יהוכה, כבר הוכרע הדין, לחייך קוידמין. And listen to this. This is the punchline of the Chazon Ish. והווה הגויזל גויזל נפש של חברו. Says the Chazon Ish, if you, after we pass him like a Rabbi Akiva, you go and you steal the water from him, you're considered to be a goizel nefesh. Remember the words Rav Asher used in order to explain to Moshe, and doichin nefesh mipnei nefesh, meaning by the psak of Rabbi Akiva, that now this belongs to this person, now the water belongs to him, so now the water is closer to him. Says the Chazon Ish, an unbelievable svara. Now the water is part of his oxygen. Imagine to yourself, you're pulling the plug on him. That's what the Chazon Ish is saying. You're pulling the plug on him. Is that mutter? No, that's not mutter. That's an unbelievable chiddush that the Chazon Ish says. And maybe that's what Rav Moshe meant. That's what Rav Moshe meant. Rav Moshe meant to say that when a person is already in the serious, in the intensive care, and he's really treated, and now by you taking him out, you're putting him in danger. That is goizel nefesh, and ein doichi nefesh mipnei nefesh. Comes Rav Asher, on the practical level, he's not arguing on that. If you're endangering somebody, for sure you can. Rav Asher says that's not considered endangering. Why? Because in medicine, think about, there is a lot of cheshbonos that doctors do, and the unit and everyone does, and their cheshbon is a right cheshbon, and you have to leave the hospital to do their cheshbonos and their way, and you're not now dealing with retzicha. You're dealing with what? Hatzalas nefashis. And a lot of times following the rules of the hospital is hatzalas nefashis, and it's not, dealing with other ways of pikuach nefesh.